You don't look like Satan to me.
I hope not.
Some of my colleagues have accused you of everything but abandoning your children to wolves. Do you hate medical research?
I've devoted my life to medical research, Senator.
Do you hate the NIH?
I love the NIH.
This budget that we're debating today is the president's budget. When's the last time Congress took a president's budget and enacted it?
You know, the funny thing is, I've gotten to thanks to this process, I've got to talk with all of y'all.
When's the last time that happened?
I can't remember.
It's never happened in the history of ever.
I mean, everyone has strong opinions about what should happen, and Congress gets to have a say, and that's a good thing.
There's some changes that need to be made at the NIH, aren't there?
There are.
Okay. If I'm the president of a university, and I came to you at the NIH and said, I need $10 million to research a cure for nephritis. And I took that $10 million and spent $5 million of it renovating the vice provost home. That would be morally repugnant, wouldn't it?
It would.
If I were a college president and I came to NIH and asked for $20 million to research a cure for dementia, and I took $5 million of that and used it to buy a yacht for my university, that would be morally repugnant, wouldn't it?
That would, and no, that's not.
And that's happened before, hasn't it?
That's not hypothetical, alas.
Today, on Capitol Hill, fireworks erupted as Senator John Kennedy confronted the National Institutes of Health over questionable spending, jaw-dropping overhead costs, and shocking research grants. From sarcasm to serious accountability, this hearing was a masterclass in political heat. You won't want to miss this. Before we dive in, hit that subscribe button and turn on the bell so you never miss a breakdown of these explosive moments from D. See, Kennedy didn't hold back. He laid out examples where university grants were allegedly spent on luxuries like home renovations and yachts instead of cures and treatments. He called it what it was, morally repugnant, the NIH official agreed.
But if you ask American people, would you rather give money to research cerebrovascular disease, or would you rather give $142,000 to the Seattle Children's Hospital to study how to use telehealth to improve access to gender-affirming care? What do you think the American people would say?
Senator, the NIH should be a non-political organization, non-ideological, addressing the health needs of the American people.
But yet, the NIH also spent $120,000 in a grant to, quote, develop 3D avatars that help people work through gender dysphoria, end quote. Did it not?
It did.
And the NIH also spent $2,368,492, gave it to Brown University to study, quote, improving mental health among the LGBTQ community impacted by the COVID-19 pandemic. Did it not?
I think it did. Although I have to say that we should...
Do you think that's more important than studying chronic lower respiratory disease?
I mean, I think we should address the real health needs of Americans, not divide Americans into we have to take into account the real differences in in the biology of people. But when we do that, we should do it in a way that really addresses their actual health needs. Not
I'm running out of time. What we have to do is spend the money on research.
We should. Absolutely.
It's real simple.
I agree with you, Senator, 100%.
And some universities aren't, and NIH is not calling them on it. Isn't it a fact that a study showed between 2017 and 2019, auditors found 137 critical trials funded with taxpayer money involving 41,000 kids, and they didn't even report the results? What happened to the money?
Senator, I think that researchers we support have an obligation to share their data publicly with the American people, no matter what the result.
Otherwise, it's wasted.
Yeah, agree.
Questioned NIH's priorities. Instead of research into deadly diseases, millions were going to studies on gender-affirming care, 3D avatars for gender dysphoria, and COVID-related LGBTQ mental health. Would the American people choose to fund this over chronic respiratory disease research? Kennedy saved one of the most damning facts for last. Between 2017 and 2019, 137 NIH-funded pediatric trials involving over 41,000 children never reported results. Taxpayer-funded silence. What happened to the money? Kennedy's final words weren't just criticism, they were a challenge. Fix it. The NIH agreed. Whether change comes next is a story to watch. .dou.
But if you ask American people, would you rather give money
and if you're
to
as fired
research
up about this as we are, click the subscribe button,
cerebrovascular disease, or would you rather give
more unfiltered
$142,000 to the Seattle Children's